Hi, this is Dr. Victoria Andarcia. Thank you for joining me again on the Healthful Roots podcast. Today, I have Dr. Laila Contractor. She is a double board certified integrative psychiatrist, and I am really excited to get to speak to you today about mental health and your journey into integrative psychiatry. Would you just introduce yourself and tell us a little bit more?
Yeah, so, my name is Dr. Laila Contractor. I'm a child and adult psychiatrist. For a lot of you who may not know, for psychiatry, we actually do general psychiatry first. It's about 3 to 4 years after medical school, and then we do 2 years of specialization in child and adolescent psychiatry. So we're kind of like family docs in some ways, where we do everything first and then we specialize. I'm located in Southern California, my office in Irvine, but I can see people all over the state. So,
Great. And what got you into psychiatry?
uh, we, especially my maternal side of the family had a lot of people who struggled. So I think psychiatry in some way was normalized. Like I saw my grandmother really struggle, as far as I can remember, with depression and anxiety. It wasn't necessarily taboo in our family. We actually openly talked about it. And I was always interested in people's stories. Even my family's from India, and even when we go visit there, I'd spend time speaking to the woman who washed our clothes. I was always interested in people's stories, like in culture, kind of what made them tick. And in medical school, too, that's what I ended up doing, was just really listening to people's stories and trying to kind of figure out I don't know, how to best empower them, how to best work with them to help them get better. That's not really a
Yeah.
suitable thing as far as like seeing patients really quickly in pediatrics or in internal medicine. And frankly, I was bored in everything else. I was just very fascinated by psychiatry from a really young age. Even in high school, I did a lot of work with eating disorder, peer to peer work with eating disorders. And so I think it's
Oh,
probably a
wow.
very long
Okay. Yeah.
standing interest that I've had
It
in
sounds like it was just
understanding
meant to
what
be
makes
then.
people work.
Okay. And when you got into the psych residencies, was that what you expected it to be?
Yes and no. So I had, um, even in medical school, I had done, extra rotations in psychiatry. Um, Worked in the area of Philadelphia. It's primarily subsidized housing, government, funded housing. So really seeing really severe cases. And so in some ways it wasn't, what I didn't expect to find. With psychiatry, we do either 6 to 12 months of general medicine, whether it's pediatrics, internal medicine. We also have to do neurology rotations. But after that was done, my very first psychiatry rotation was actually on the inpatient substance use unit. And one of my beloved attendings, Antoine Douay, taught us something called motivational interviewing. And what I saw time and time and time again were these just horrific stories of trauma. And what I this was actually my first introduction, I would have to say, to the impact of trauma. And I kind of became hooked as far as understanding trauma. Um, but I just couldn't believe it. I mean, it was just unbelievable. It was not one person, it was every person who walked in, and we did this style of, interviewing slash psychotherapy. I understood why people would use. What else would you do if you had all these horrific stories
Mm.
and horrific things happen to you, but you didn't actually nobody really taught you how to cope with it, nor did you get any of the right services. And my subsequent rotation in the area called the Hill District of Pittsburgh, so another area which is primarily, projects you would call them. It was the same thing. I'm not sure how much psychiatry I learned. I learned just the horrific circumstances people have to live under and how much trauma they have to face, and we still expect them to function quote unquote normally.
Yeah, and trauma has become like more something that we talk more about.
Right.
But with your experience, how do you like navigate that with a patient?
Meaning when I first see them,
Yeah,
so I do the usual history like any, physician would, finding out past medical problems, past surgical issues. I spend a lot of time on family history, understanding the genetics, right? That's many of the psychiatric illnesses we're understanding, including addiction, by the way. And newer research is showing that 50 to 60% can actually be genetic. Um, so a lot more than we previously appreciated. Um, so But it's something that I don't kind of jump away right away and ask anybody. Who would you? The most important thing I can do is help relate to people and then make them feel comfortable. And then we ask. But naturally, I'll be honest, even before I ask people, it's woven in their story. And so, as much as I can
okay,
get people to give me their story about who they are, what they are, it comes up. And then of course, uh, I will still ask about it, but it typically comes much later, when people feel comfortable. And the other thing is, I think, is the most important thing I've realized is it isn't necessarily important for me to know all the details. I'm happy to hear them. I've heard so many stories, but what is the impact on that individual? That's actually more important, because sometimes people have horrific things happen to them, but because of how they were held or how they're validated, they don't have the PTSD. They don't have the developmental trauma. They don't. They had the other things around them that supported them. So even my own mentor used
that
to
makes
tell
sense.
me, yeah, Dr. Judith Cohn, who developed trauma focused CBT. I mean, we still did the UCLA stress index, PTSD index, but she really told me at the end, it doesn't matter. It doesn't matter how many symptoms they have. If there's functional impairment, it doesn't matter. If the kid can't go to school, if the kid can't make friends, if the adult's not going to work, can't have meaningful relationships, how does it matter how many symptoms they have? Clearly, the trauma has impacted them in such a way that they can't function in a way that they need to or want to.
Yeah. Yeah, right. And what are the therapies for someone who has trauma? Like, what would be the steps? The reason I'm asking, I recently read The Body Keeps Score, and then he talks about certain therapies in that book. So I just wonder how much of that is integrated into therapies now.
It depends who you talk to, but so I came from being trained in trauma focused cognitive behavioral therapy, right? So the idea that, the thoughts that we have affect our behaviors. So the idea would be if you thought, um, I'm a terrible physician, we look at how would that make you feel? Probably not very good. What are the thoughts that come with that type of thoughts? Like, I'm no good, I'm this, no one will come to me, whatever. And then how does that make you feel? And you rate that. And then you think of an alternate thought. Like, I'm learning every day, and each day I'm becoming a better physician for the new knowledge I'm getting. How would that make you feel? You probably make you feel much better. Right? You rated that and just
Right.
thought, what's the feeling that comes with that? And then kind of what are the thoughts that come with that type of thought? So that's how trauma focused cognitive behavioral therapy works. It also works, so it works on those. So many people will have distortions about their role in what happened to them, especially children.
Mm.
Children are much more likely to blame themselves, because that's often what they're told. Um, so we look at that, and it also depends on exposure. Being exposed to, they actually create a narrative of what happened, and then kind of an alternate narrative of them now, right? Like kind of the
Mm.
rebirth, regrowth. In my opinion, and people would disagree with me, I think that's great for single incident stuff if you've had one offs. What I don't see it happen is if you have somebody that's repeatedly been in a domestic violence relation. It's not just one incident we're dealing with. We're talking about potentially years. similar
Right.
with kids who've had, um, been in either violent situations. And I think what I tend to see too is neglect. So, I mean, I went from doing community psychiatry and working in East LA, South Central Compton area to now I'm working in a relatively affluent area. And I would tell you, in a weird way, the neglect is almost worse than what I ever saw in those areas. Um, because there's this illusion that because they have, the great education, the expensive cars, the great house, so they're not worried about food and stuff. But the type of neglect I see where parents expect that to be everything and that's the only thing the kids need is almost worse. Um,
Mm.
and so I think there's been a real shift, and you're even seeing the body to do more what we call like somatic work. Our
Mm.
body stores our traumas, and especially the younger the trauma happened, what is actually much more familiar is actually the feelings that are associated with what's happened. You know,
Mm.
and Dr. Vanderkolk talks about this in the book that you're reading or have read. When you look at functional MRIs of people's brains who've undergone trauma, and either somebody's talking to them about their trauma or they're talking about it, the area of the brain, our Broca's area, our speaking area, is actually understimulated or completely shut off. And so we're actually not meant to talk about our traumas, nor do we often have the ability to talk about our traumas. So the more work I do with this, and I think especially high functioning trauma survivors, like the ones who are the CEOs that I'm seeing, the people who've had very successful careers, they're great at being in their head. That's not a problem. They can talk themselves into or out of anything, right? This is how they function. This is how they've
Yeah.
managed to function. The most important thing we can do to them is get back, and I include myself in this too. I can talk myself out anything. The most important thing we can do is get them back to what is it like in their body? What is their body telling them? Because most of the time they are dissociated from it, and that is how they have survived and how they've managed. And again, it's not even just people of high paying jobs, anybody with trauma. If you need to survive, if it is not safe enough for you to process your trauma, you will live in your head. And so that's why I've kind of I feel like, again, trauma focused CBT has its place, but things like somatic experiencing, we're really honing in on when you speak about your trauma or when even the thought of your trauma comes up, where is it in your body? EMDRs, so is another type of, I also, and I'm probably in the minority with this too, I feel like what I've personally seen is it can be great for single incident stuff. With somebody who's had a lot of trauma, what Bessel calls developmental trauma, right? Trauma for a very young age. And it wasn't just one incident or 1 year. It was like over the span of your childhood, let's say, where you grew up in difficult environments. Not terribly, it's not, because you can really start, and I recently had another patient that this happened to. You start opening up some of those memory networks, and now all of a sudden you are like having them go into lots and lots of incidences. It's not just one that you're
Mm.
working on. And that becomes challenging. And I have several patients who come in and that you can see their entire nervous system is just, all I can say is it's jacked. It has been flooded with memories that are coming back. And that's not doing anybody any good. There is a newer type that Lauren Parnell teaches where we kind of really much more heavily are resourcing people. Again, getting people to identify where in their body, giving them the tools to stay grounded, work with like their nervous system being so activated, and then processing. And so
Okay.
I feel like those body based treatments, internal family systems is another one, where you learn about why you did what you did. Like if you have rage, what's the function of your rage? And that isn't necessarily a bad thing, but what is it teaching you? What did it protect you against?
Yeah, I started reading that book, didn't finish it, the internal family
Mhm.
systems one. But so
Yeah.
it's interesting that you mentioned the nervous system because I see that part, right? Like
Yeah.
I'll see people who are coming to me with like debilitating anxiety or like depression, but like they can't, it's almost like they don't associate it with like past trauma because
Right.
they're like right now everything's okay. Like I have a job, my kids are good, and my wife
Correct.
is doing fine. So like how do you help someone who can't really like correlate it because you know they have a traumatic past, but they're like, but right now I'm fine. But you're like, that anxiety is coming from somewhere, right? Like these
Right.
emotions are coming from somewhere. So how do you navigate that?
So we do a lot of psychoeducation. I mean, about it, about, and again, depending on when the trauma occurred for them, right? So with really young kids, what we now know is that trauma affects IQ, trauma affects brain development, and trauma in essence keeps you stuck. Your body, it's a kind of a fantastic mechanism your body is trying to have of keeping you remembering the bad stuff that happened. The body thinks if I remember, then this will not happen again. We won't go down that. If I keep making you remember what happened, like this, you won't do this again.
Hmm.
But between being stuck like in your memories and the high cortisol levels you have, this does impair brain functioning and it impairs people developing normally. And I call this I call it acquired neurodivergence. So I'll tell you, a lot of my patients who have childhood trauma could easily in some ways qualify for being on the spectrum somewhere because trauma
Hmm.
doesn't, if you are so focused on survival, you are not meeting developmental goals. You are not like working on your social skills. You're not working on conflict resolution. You're not working. And so we also see a lot of developmental maturity. But anyways, back to your question, I kind of talk about these things that this is what happens. Like you really get kind of stuck somewhere and it's showing up like this. So 100% I can give you medicine, right? Like medicine. So as an integrative psychiatrist, people like will come to me like, "Oh, you don't believe in medicine. You're a holistic psychiatrist." It's actually not accurate. It's all I tell them it's all about balance. So people will come in wanting to, let's say, do psychedelics or ketamine. But the picture they're presenting to me is I need to stabilize the heck out of them before we even go towards what they need to. And yeah, so you need medicine. I'm going to prescribe you medicine for that. Because what we do know is medicine helps with containment, our traditional medications. Um,
Right.
so what I encourage people to do is like, look, I can give you X, Y, and Z, but until we actually get to the root of what's causing your anxiety, this is going to be an all like I can keep prescribing you stuff. I can keep so it takes time, and you have to. I feel like it's like a we like crouching tiger. Like you're just kind of waiting and slowly to see when can the patient kind of accept and hear this stuff because it can be jarring
That makes sense. Yeah. Yeah, I
for
agree, and that's
them.
a conversation I have with patients as well, because I do integrative medicine. Is the medication is necessary in some cases and helpful, but I'm very much for exploring like why, right? Like
Right.
what's going on, because otherwise, like this can happen like 5 years later, where you find yourself in another loop, and we never really identified the source.
Yeah, and I also, I mean, again, as an integrative psychiatrist, I use I use various supplements for different things, but I mean, there's a phrase I use to my patients, like, you're not going to supplement your way out of this one. Like you, like
Hmm.
I can continue to give you a supplement after supplement, but unless we address the root of what's causing you to feel this down, we're going to be in the same cycle. And maybe this time it's celiac. Next time it might be a hypothyroid, right? Like there'll be different things that are
Yeah.
going to come up and manifest physically. I often will tell patients we have
Oh,
nerve cells everywhere. Why wouldn't your nervous system react in other places?
okay, and I just want to highlight what you said for people who are listening. So you said it can manifest as celiac or hypothyroidism. So unresolved trauma, I guess, or unresolved emotions can cause medical conditions that we know.
Yeah, so Dr. Gabor Mate talks about this in his book. It's called When the Body Says No. not to be confused when the body keeps the score. But what is fascinating, I think, in that book is he talks about he quotes a ton of research. So he's not just, I think he gets criticized as saying everything is trauma, which not everything is, of course. But he goes through, like, one chapter will be on ALS, another chapter will be on breast cancer, another on colon cancer, another on MS. Fibromyalgia is a perfect example to me. But he talks about the research is really not being done anymore of the manifestation. Again, is it only one thing? No, it can be multiple things that cause it. But we now know through Vincent Folletti's work and, the ACEs, adverse childhood experiences, those people are much more likely to experience medical problems. So it is a big trigger. And whether it's the cortisol, like the high rates of cortisol that are causing it, that, the stress on the body year after year, decade after decade, there's probably multiple reasons for why trauma and stress are related to those things. But we had, there was a researcher when I was in training her research was on what we call functional abdominal pain, right? Your patients who come in and we can't figure out why they have what I call the $1 million workup. We can't figure out why they have abdominal pain. This particular study was done in children. And essentially it was done with clinical hypnosis. All of those kids had trauma. Every single kid had trauma. So anyways, it was a long-winded way to answer your question, but I really go over, like, we really educating them of the biology of the body, like how we have more nerves in our gut than even our brain, like how that affects us. And that this is just another way that your body's trying to tell you that, like, you kind of need some help. But I think you have to balance it with hope, because we have much better resources than we've ever had, even from 20 years ago when I finished training. Like, we have better things to offer people.
Yeah, and so many new modalities that you're learning about, and like you mentioned, like EMDR and like all these other therapies. I just learned about that. Not just, but like within like the
Right.
last 5 to 7 years, like I started hearing about this and I hadn't heard about it before. So I did want to get into like the integrative psychiatry, because from what I read, I think there was a personal experience that led you to integrative psychiatry.
Yeah. So I'd have to say it was probably, my family's from India. I had an uncle who was a homeopathic physician, and it actually ended up treating a lot of the royal family. I had a belief in other medical types of medicine. So I think I came in with that, but it's actually about 6 years ago, around this time, I started becoming pretty, like, inexplicably unwell. And I kept blaming it on different things. I thought it was the way I was sitting at work. And ultimately, I actually just, one day I called my boss and I was like, I don't know what's happening. I was having what really felt like ascending weakness and paralysis. My respiratory muscles were compromised, had right-sided weakness. And I went to, like, multiple medical institutions.
Sorry.
That's okay. I have dogs at home and they like to bark at inappropriate times too. And I met some great doctors. I met some awful doctors. I was on medical disability for like 2.5 years. And people could see that there was something wrong. Like, tests would show, like, there's a neuromuscular etiology for why I'm struggling to breathe. I had autonomic nervous system problems, but people couldn't figure out what was causing it. Like, you pinpoint, like, okay, yeah, this is going on, or yeah, we can see you have terrible right side weakness. And one day I posted my case on it's a Facebook group called Physician Mommy Group. I posted everything, like every lab, every imaging, and I followed everything. Anything anyone said, I write it down and did it. And at this time too, I had neuropsych. I finally pushed for neuropsych testing because I kept telling everyone, I was like, my brain is just not working, and no one would believe me. finally, I was like, I've forgotten to pick up my kids 3 times from school, and that was like really that was like the last straw.
Oh, wow.
And what it showed is my verbal memory was in the less than first percentile. I was like, see, I told you it wasn't just not in my head. Like this is like but on the physician mommy group, I kept getting direct messages from integrative medicine doctors like you're not like yourself. They said your case is really typical for us. You're not going to find answers in traditional medicine. So I feel so bad every time I tell the story. I'm like, there was this amazing physician from Chicago who spent all this time and was like, hey, you should see Dr. Kelly McCann. Like, she's amazing. So I went and saw Dr. McCann, and I saw her, and I thought it was a load of crap. It was expensive. She told me I had Lyme, and I grew up in Pennsylvania. I used to vacation in Connecticut. I was like, you guys don't know what you're talking about. Like, how does everybody have Lyme? And anyways, lo and behold, I kept getting worse to the point where I was actually just in bed all the time. And one of these doctors sent me a direct message and asked how I was. And I told her, and she's like, what are you waiting for? She's like, Dr. McCann gave you an herbal supplement to treat your issue. Why don't you just take it? She's like, it can't get any worse. And I was like, you know what? She's totally right. And I took it, and it halted the progression of the illness. And so it got my attention. So I went back to Dr. McCann, and I was like, I'm going to do, and at that point too, I found out about the neurocognitive problems. So I was freaked out because I was like, look, if my body goes, it's okay. But in my specialty, like I can't lose my brain. I need my brain. So I told her, I was like, I'm going to do one thing at a time. And slowly, I went from, basically being in bed all the time and saving all my energy for my 3 kids when they came home to now. I mean, I go to the gym every day now, and I'm not 100%, but I'm pretty close. So,
And
but
it was actually Lyme?
well, I have various thoughts about Lyme disease. The treatment for Lyme worked.
Mm.
So the treatment for Lyme worked. A twist in this story was when I stopped breastfeeding my youngest, I started going to a depressive episode. I wasn't sleeping, and I was like, I know this story. I was like, I'm going to give myself some Prozac and Trazodone and call it a day. And unfortunately, it was about 3 weeks after starting that I started becoming ill. And, fast forward, I was getting all these IVIG treatments because they said ultimately this is likely you're pre-autoimmune or autoimmune. You have some sort of autoimmune issue. And IVIG was working, and I was sitting, you have to sit there for long periods of time. And as I was sitting there thinking, I was like, I think my antidepressant's making me sick. So I basically stopped it and was acutely suicidal. But
Oh,
I started
wow.
physically feeling better. And so it was actually part of the reason I was so ill was because of the antidepressant. And it happened on 3 different ones that I had autoimmune issues. So I'm a psychiatrist that cannot
have you seen that
take.
in your practice?
I have seen 2 other people with it now. What we do know is
Mm.
medications like Prozac can cause autonomic neuropathy, a pseudomotor neuropathy, basically impaired sweating. And so I think it was, and I that was one of the diagnoses I had. I mean, there was one summer I couldn't even leave the house. I couldn't sweat at all. So anytime you go out, I'm in California, right? I mean, I would just overheat and I'd be done for the rest of the day. So they can wreak havoc on your nervous system. I actually still have a lot of the right side weakness is improved. There's still residual right sided weakness. It seems to be something with the serotonin because recently, by mistake, I took some St. John's wort, which actually works very similar to SSRIs. And all of a sudden, I was having the same slurred speech. I was having people thought I had a combination of like ALS or MS or the both. That's what it
Oh,
presented.
wow.
And I started having the symptoms. And then I was like, and then I realized, and so I stopped the supplement. And about a month later, it was better. It was pretty bad.
Wow, I've never heard of that. That's like interesting. I mean, it's interesting, but also very scary.
Yeah, no, I've met now 2 other people So I'm supposedly supposed to write a paper about that,
I mean,
but in my
sounds
free time.
interesting. It's paper worthy,
I know.
but I'm sure you don't have a lot of free time. One of the questions I wanted to ask about, you kind of touched on it briefly, was using psychedelic assisted therapy. That's all like the rage now. I've seen
Right.
a lot of positive stories about it, but I've also heard like horror stories where like after people like turn their life upside down uh, because they went on an ayahuasca journey and like didn't go as planned. Uh, I guess those people are probably doing it in a way that is not recommended and it's not how you're doing the psychedelic assisted therapy. So I just wanted your thoughts on that and what are the right ways to go about it.
Yeah. So in my own journey, um, antidepressants were off the table. And what I found myself in was pretty severe, what we call discontinuation syndrome. And I think medicine doesn't acknowledge that it occurs. And I mean, it happens and it's pretty severe. And actually, a lot of patients I see, I actually using integrative psychiatry treat for that because it can be horrific. Um, I, by all practical means, actually very slowly from February to like March. This, I think, was I'm sorry, February to May, like every 2 weeks lowered, but it was awful. But I was in a hurry to get off because I knew it was like, I mean, it was making me sick. But with that being off the table, really a lot of my own complex trauma or developmental trauma, as Bessel would call it, really emerged. And as soon as I heard, I mean, as soon as the doctor was like, they think this is likely autoimmune, I mean, I knew, I mean, I'd seen it in thousands of my patients, my patients with lupus, like they all had trauma. So it's interesting, I read Gabor's book much later, but really his book validated what I had clinically seen. I mean, I'd worked at Kaiser, so we saw such a high volume of patients. Kaiser's, and for those who aren't familiar, is basically an HMO out here that has a whole hospital system network. But I saw it time and again. So I was like, well, I don't really feel like my life was that bad. I had the same thing. I had the roof over my head. I had, my parents supplied really everything that I could have ever wanted. Um, but that's when I started much more intense trauma work. Um, but with antidepressants being off the table, with me being severely depressed, and then really what we call complex PTSD, I was really searching. I was doing my integrative psychiatry program. I happened to meet Gabor. I raised my hand. I didn't know anything about him. And in 15 minutes, he nailed what none of my other therapists. I mean, I've been in and out of therapy half my life. I'm a psychiatrist. So what we do to support ourselves. And he was like, read my book when the body says no, and then call me. And I did. But by then I'd already become kind of a groupie. I like joined his basically his training, the year-long program. And I went to a workshop of his and he said, I'm going to be in San Diego. I didn't know what the workshop was about. I didn't care. I signed up. It was on psychedelic assisted psychotherapy. And as I was sitting there, listening to the research that had been done, I felt actually embarrassed because I considered myself like a psychiatrist whose specialty is trauma, and I didn't know about these medicines. And that's how my interest was sparked. And for me, the first one I did, as I was desperate, was ayahuasca. But yeah, I think so. When I say psychedelics, it's a huge group of medicines. Ketamine is the one that's currently legal in in all states. Psilocybin is used for therapeutic use and is decriminalized in certain states like Oregon and Colorado, Santa Cruz, Oakland, and California. It's decriminalized. There's other pockets that have either decriminalized or approved some of the psychedelics for therapeutic use, but it's ketamine, psilocybin, otherwise known as mushrooms, MDMA, otherwise known as ecstasy, ayahuasca, iboga or ibogaine, to name a few. There are other peyote, there are other psychedelics that are used. So yeah, I think people are treating it like a panacea, but similar to like even how I approach integrative psychiatry, which is with a lot of balance. I really think what's missing for people is that they're really, even when I came to ayahuasca, I mean, first of all, I've been in and out of therapy like half my life, but also been in really intensive work for at least a year and a half before coming to it. I think what people don't realize, even the research studies, people were getting anywhere from 6 to 10 hours of preparation to help prepare them for what we would call like a journey.
Mm-hmm.
And in the preparation includes having realistic expectations, right? So the idea is everyone thinks it's like a one and done. And there are those stories where people are just really, um, I would have to say those people are ready. In some way or another, they've already been preparing. And so they met the medicine, at a right time. And, you know, but most people, and I'd say 99.9% of people, it's not a one and done. But there's a lot of emphasis that needs to be placed on preparation. And then in the journey, it is, especially depending on what type of medicine you're working with, it is really imperative to find an amazing practitioner. So what do you look for in a practitioner? You want to make sure you have a practitioner that is like really working with you together. There cannot be this like kind of hierarchical thing. You need a practitioner who's doing their own work. All of us have our stuff. I don't care what anybody says. Like we all have our stuff.
Yeah.
But you really need a practitioner who's coming from it like a place of reverence and respect for what these medicines and with humility. And then you need a practitioner that's going to be able to hold the things that come from these sessions. And then the biggest work happens in what we call integration. So for those of you who haven't had a journey, what tends to happen is a couple of things. One, what psychedelics do better than anything I've ever seen is they can augment what's happened to you. So if you've had bad things or happen to you, it actually augments it and brings it to the surface and kind of into your consciousness. It helps you process it, which can be uncomfortable. This is what people sometimes, label bad trips but this is where the preparation comes in to give you the tools of how to be with that. And what it helps you do is process trauma that either you're too checked out to be, to process because one, you were too young or was too, whatever it was. Either you're checked out, you didn't have the tools to process it. Like the tools I have now to process what happened to me as a kid are so different than what I had as a young kid. None of us have the tools for some of the gravity of the trauma we experience. So it helps you process, augment it, helps you process it. And then on the other side of that is, insight, growth, expansion, and what psychedelics do better than anything I have yet to see. So in Western culture, I think this is changing, but we tend to see the mind as separate, first of all, and it's not. It's a part of this like whole intricate, beautiful network that affects everything. We also think trauma only affects our brain, and it doesn't. Whereas indigenous cultures have long known that trauma, affects the brain, it affects the psyche or soul, and it affects the body. And so psychedelics help to heal all three of those, and the soul, the mind, and the body. Psychedelics and in indigenous cultures also have a sense of trauma that we're just kind of starting to grapple with in the West, which is that whole communities, and there can be collective trauma. And I think the closest thing people can understand is COVID did. I don't think anybody I see today, not one patient has come out unscathed. And this is really like the most recent form of collective trauma. Obviously, a war would be a collective trauma that everyone has gone. And they deal with that very, very differently. So you can have images that come up of what's happened. You can actually have very somatic experience. So meaning you actually feel what may have happened, whether it's the shame, the grief, the sadness, pain. And sometimes it's just only a feeling. It's like a overall feeling. You get messages that come out that are essentially reflecting your own inner consciousness, your own intuitive. Um, we all have intuitive abilities. We're born with that. It's just that they often, with time, get covered. We're just trying to
Mhm.
survive in this type of world. And so, anyways, I feel like psychedelics do that better than anything I have ever seen. I mean, I didn't realize how much of a cliche it was, but the first time I sat 3 nights drinking ayahuasca, I felt like it was 5 years of intensive psychotherapy, intensive trauma psychotherapy. So it can be really effective, but you have to be prepared, and there's a time and place for that. And so what I see is sometimes people are kind of overzealous. I mean, and people are desperate, understandably. People want to get better. Um, but there can be a deep danger in that, and that can be actually even more traumatizing if you are
Yeah.
not. I mean, because as it is most of the time when bad things happen to us or not so good things, there isn't people to hold us. There isn't people to validate what's happened. Having an experience like this can be re-traumatizing because it continues to be not validating.
Right. And, I'll share that in February of 2020, I went and I sat like for ayahuasca, but it was a one night. So when you said 3 night, I was like, wow, she's brave.
I didn't know what
Because,
I was getting into. I didn't YouTube it. I didn't Google it. I was like, my therapist said it'll help. Gabor said it'll help. That research said it'll help. It's going to help. Had I looked into
yeah,
it more, I might not have done it.
it's great that you did it, but I do want to, emphasize what you just said is that you have to like be ready. And I think like intention matters. Like I went into it like, oh, like this is going to fix all the things. And I'm going to come out of there and I'm going to be like super enlightened and everything is going to be fine. And nothing happened. Like, so like I got sick. I didn't feel good. Which maybe is what I needed to feel. But it totally was not what I was expecting, but I also went in like with just thinking that I was going to do it once and everything was going to be fine and that was going to be
Yeah.
the end of it.
And
Yeah.
people often can have what they think are non experiences. Um, so with ayahuasca, I mean, right, this is the famous purging, right? People purge, and it can come from both ends. You can purge by sweating, you can purge by crying, you can purge by yawning. There are multiple. I would argue and say she, as in the spirit of Ios, is probably still working
Mhm.
on your nervous system and possibly preparing you for future things. Sometimes for some people, the insights come much later. So I've sat with, patients who didn't have anything, but then in the days following, there were just kind of insights that were coming in for them. I don't know if your experience was like that or not. Um, I also think I've sat with people that I've brought and they've had not, and I'm not saying this is you necessarily, Victoria.
Mhm.
Um, they didn't have experiences, but in hindsight, in my opinion, they weren't ready, and it's as if the medicine knew that if they
I feel
opened
like that's what it
up
was.
these things, it may be so. But it's hard to say. Sometimes there are actually. I had a patient that I didn't have any experience, but as far as I could tell, it was like literally she was being reborn. Like she was. It seemed like it was actually, and this is actually a common experience people can have, is a feeling like they're. I mean, she's letting you know you are being reborn. It's time to be reborn.
Oh wow. Yeah, no, I think it was for me, I don't think it was like the right time. I don't think I was ready, but I do think that that is like psychedelic therapy is a great advantage, something that we're doing now. I read How to Change Your Mind by Michael Pollan. And that was like the
Yeah.
first book that I read about like psychedelics. And that's why I was like, oh, I need to go and try ayahuasca and see like what happens.
Yeah.
But do you think that, I know they were talking a lot about like MDMA therapy and it was like in phase 3 trials and then something happened and it kind of got like cut off. But do you see like the future of like integrative psychiatry or trauma focused therapies, like including more of that?
Oh, yeah. I mean, I was in my integrative psychiatry classes where I was first actually, um, we're just kind of, there was the introduction to it, but very much so. I mean, to me, this is like kind of like the next big revolution for psychiatry. I mean, for years I feel like, I mean, if you look at SSRIs, and again, there's a time and a place for everything, but if you look at the research for SSRIs, they have 33% remission rate. You know, if I told you, like, I'm going to give you an antibiotic that has a 33% chance of treating your pneumonia, like, how likely are you to? Now, there's many reasons for that, right? Like, the reasons we're depressed, stressed, etc., have to do with so much other social factors, like, you know, our families, our work, our jobs. So it's not, that's kind of too simplistic to say,
Yeah.
but the studies are showing that the psychedelics are much more effective and lasting effects. Even like one psilocybin journey, people 6 months out are showing significant decreases in depression and anxiety symptoms. Um, there was a Stanford study done with ibogaine in veterans who had not only PTSD but traumatic brain injuries, and the results for that were mind blowing as far as even again 6 months out, most of those patients, 80+% showed remission of depression, anxiety, PTSD, showed improved interoception. So the ability to understand how you're feeling and what that means for kind of for you. I mean,
Oh,
a real
wow.
simplistic for interoception, right? Like if I understanding that that feeling in your stomach means that you're hungry. That sounds very simplistic, but for a lot of people who suffer with trauma, if they felt everything in their body, especially in your combat situation, you don't have time to process what's happened. It is not advantageous to feel. If you're a child, it's not advantageous to feel. So bringing back those things online, they showed improved executive functioning. So yeah, unfortunately, August 9th of this year, the FDA decided not to approve MDMA as a treatment. And I thought that was a bit of a blow, especially to the veterans who, I mean, we now have more veterans. I'm part of a nonprofit group called Care Possible that provides free mental health and addiction services. And I'll tell you, I've been doing this for 20 plus years. The type of PTSD that I see in veterans is like next level. And I think it's because it's often combined with TB, traumatic brain injuries and acquired brain
Mhm.
injuries. Um, so unfortunately, I feel like people are going to continue to do it in the underground because people are desperate and people want to get better. People are going to keep going to Mexico to access treatments. People will go to, you know, Oregon, Colorado. People will still try to access. Um, but what's hopeful is that you know, they're going to do more research. They're going to be more phase 3 trials. There were problems with some of the past research that was done. So those things will be addressed. And hopefully the next time around it will be approved. Um, I know I don't mean to bring up politics, but Robert Kennedy Jr. is just, you know, named head of HHS. And there's lots of feelings around that, but the one pro is his own son. His wife had died of suicide, and the youngest son he talks about who struggled so much with the loss of his mother, and he was very much called to ayahuasca. And his story, his son's story, is one of those remarkable stories about how he felt so connected with his mom, how his mom spoke to him, and how he's a different person. And
Yeah.
so hope there's maybe more hope around the corner that this will just become more accessible. But I think again, it has to be accessible with lots of caution. I think there's a lot of people are very well intentioned, well meaning, and overly zealous, but a poorly held ceremony or a poorly held journey is really rough. for everybody involved. And
Yeah, I can
again,
imagine.
as physicians, therapists, anybody, we really don't want to cause more harm ever
No,
to our
no,
clients.
no, I agree. But I appreciate you sharing your story and sharing your insights, especially the psychedelic therapy, because it's, a lot of people are talking about it. So I loved hearing your perspective. And my last, question related to this is if you have a patient who's coming to you and they're like, I'm desperate, I would do like anything, like, what do I do? Like, how do you kind of guide them? Like, what would be the first steps that you recommend to someone who's feeling like that?
So again, the first step always would be some sort of stabilization. Um, and again, working with the clients, like I had a client like actually just last week, very much wants to do this work. He very much, unfortunately, this is one of those situations. So the EMDR helped him to an extent with certain flashbacks and certain stuff, but it opened this whole spiral of memory networks. And he is just like, even in the session, it's like he couldn't stop shaking. You can see the nervous system is just in, like, really in shock.
Hmm.
So we still work on stabilization, work on doing really working on the preparation piece of it, helping him with various somatic experiencing tools to help, regulate his nervous system. Working on what happens if difficult material comes up for him during the session, what that looks like, whether it's saying certain mantras or phrases, whether it's certain types of breathing. Those are the type of things, but we still try to work on some sort of stabilization to make sure that the journey is kind of as helpful to them as possible, because the journeys themselves, they can be difficult, and that people have to be
Hmm.
prepared for that. I think people have this idea that, oh, you get all these visions and it's amazing, and yeah, some people, can have those. The first time I sat, it was like that for me, and ever since then, she's been giving me a beat down. I say that, but really, I notice my nervous system is in much better shape every time after I come back. My mood is
Hmm.
improved. I get different insights. I mean, a lot of this work is like a mirror. Like, what am I doing to create my own suffering? Which we all do. Like, we all, on some
Right.
level, are in our own ways. But honestly, that's what I recommend. But then on the other end, I had a vet who was like, I really thought that was working with through the night. I thought I was going to lose him. I don't know what to do. When I first saw him, looked amazing. And then event after event after event. And literally, I was at the point where it's just like we're on the phone every day. And I was literally praying that he just makes it to the retreat. And he did. And it was profound. And is he cured? No. Is he Did he do a 180 where he's not suicidal? He's able to be a parent that he wants to be. He's gotten a new job. All these things he has. That's an unusual situation that I would have sent, but he was already slated to go. And in the month before he left, everything just started, which, by the way, is actually, unfortunately, a common phenomenon where they talk about the medicine bringing out things that you need to work on
Oh,
during the ceremony. So it's not uncommon for people, but this was like, I mean, I was really nervous for him, and luckily it went right. But that's unusual. I wouldn't have usually been okay with that, but the usual things were not actually working for him.
oh, wow. Okay. And you only see patients in California
Yeah,
right now?
I have licenses in Colorado and New York and one other state. I need to get my malpractice in those states too.
Okay, well, if
But
you ever
so
get your
far I'm
license in
seeing.
Florida, yeah, then we would love to have you here. I know a lot of
Oh,
patients that would benefit from having you.
oh, thank you. That's so sweet.
Yeah, and so you have your own practice, right?
I do. I have my own
And then you
practice here
do,
in California.
yeah. And do you I know you have a social media. Is there any way that people can connect with you if they have questions?
Yeah, so you can certainly email me at admin, so ADMIN at Laila Contractor MD. I know I have a really long name. So Laila Contractor MD.com. That's one way to reach out. My socials, my Instagram is holistic.psych.doc. That's another way people can reach out. And I'm also on LinkedIn and Facebook under my name, which is Layla. I have two middle names, so Layla FM Contractor MD.
Okay, great. Yeah, I'll put those links in the show notes. And I just want to thank you again for the conversation. I learned a lot, and I'm sure it's going to be helpful for a lot of people. I really appreciate your time.
Thanks for having me.